So, hello everyone, and we'll be discussing a spotter case today. So, here we have a 35-year-old male who presented with symptoms of severe low backache, and he got a MRI LS spine done for the same. And these are the SAG sections, T2 weighted images of the LS spine. This is L5S1 level, and we can see some hyperintensity in the end plates on these T2 weighted images, which appear hypointense on T1 weighted images. These are the SAG images, T1 weighted L5S1 level. And there is some disc bulge or herniation that is seen here. These are the stir images where again we can see that there is marrow edema which is seen in the end plates of L5S1 vertebrae. And these are the diffusion weighted images where we can see that there is some restriction in the end plates, giving a claw type appearance. So this is a report that was given by me, that there was disc desiccation with diffuse posterior disc bulge with posterocentral disc extrusion causing thecal sac indentation and canal narrowing along with bilateral neural foraminal narrowing at L5S1 level. The vertebral end plates at L5S1 level showed hyperintense signal on T2 and stir and hypointense signal on T1, suggesting marrow edema, and there was diffusion claw sign on DWI images. And the features were suggestive of type 1 modic changes of L5S1 level. So what exactly are modic degenerative changes? There are three types of modic degenerative changes: type 1, type 2 and type 3. Type 1 represents marrow edema, type 2 represents marrow ischemia and conversion to yellow fatty marrow, and type 3 represents sclerosis. So this was a type 1 degenerative modic change which represents bone marrow edema and inflammation, and it appears hypointense on T1, hyperintense on T2 and stir, and it shows post-contrast enhancement. This is very important. So it is very difficult to differentiate from infection or spondylodiscitis, because spondylodiscitis will also show edema and will show similar signals on T1 and T2 along with post-contrast enhancement. So what is the method to differentiate it from spondylodiscitis? So I asked my technician to get a DWI done. So on DWI, what we see is diffusion claw sign, which is suggestive of degenerative modic change. So on diffusion weighted images, if it is a degenerative change, modic type 1 change, there is well-defined paired band-like regions of restricted diffusion affecting two contiguous vertebral bodies resembling a claw on the SAG images, and it is highly predictive of degeneration. In contrast, if there is diffuse or amorphous DWI hyperintensity and absence of a claw morphology, it predicts spondylodiscitis. So this patient particularly didn't have any fever or any history of infections in the past, and he had just a low back ache, and along with the disc bulge and diffusion claw sign, it was suggestive of type 1 modic change.